So there is TB disease, and there is what we call latent TB. So there's active TB and passive TB. So latent TB means that you have the bacteria in your system circulating, but you don't exhibit any signs and symptoms. What are those signs and symptoms? Those signs and symptoms are, so if you have pulmonary TB, that's TB in your lungs, you will have a productive cough, meaning that when you cough, you get coal come out. The coal can be yellow or green or even brown, uh, or with slight blood. So if we see the coal with blood or is brown, we know that there's a classic sign of TB.
That was Dr. Quacy Grant, who is responsible for TB/HIV in Guyana. TB is accompanied by fever, loss of appetite, followed by weight loss, and persons can even experience diarrhea. Once a person has extrapulmonary TB, a productive cough will not be present. Instead, persons will experience nerve pain, night sweats, and other symptoms, all depending on the type of tuberculosis they may have.
When we screen persons we have a special skin test that we do called Mantoux test, and we usually screen contacts of TB patients, persons with TB disease with a Mantoux. And once we find them being positive, the skin test is positive, it's reactive, then we treat them for latent TB infection because we don't want them to develop the TB disease.
Because tuberculosis is contagious, patients are administered their treatment via directly observed treatment short course, DOTS, where the doctors observe patients consuming their medication. A combination of isoniazid, rifampin, pyrazinamide, and ethambutol antibiotics are used for at least 6 months and can increase depending on the type of TB the patient has. The 4 antibiotics are given to the patient over the period of 2 months. When the patient is no longer contagious, the antibiotic number is reduced to 2 for the remainder of the treatment regimen. Meanwhile, Minister of Health Dr. Frank Anthony on Wednesday stated that Guyana has generally done well with managing tuberculosis. He said the country has recorded a reduction in the number of cases. Dr. Anthony said the ministry has introduced a number of innovations to monitor TB patients as the treatment period is lengthy.
As we celebrate World TB Day, we still have a number of challenges that we have to work on, but I'm very satisfied with where the program is today and the work that they have been doing.
Being celebrated under this year's theme, "The Clock is Ticking," World Tuberculosis Day originated on March 24, 1882, upon the discovery of the disease by Dr. Robert Koch. For the newsroom, I am Shena Henry.